I used to forget everything I learned until I learned these memory cheats. I'm a fourth year nursing student and I'm a final year nursing student, and here is exactly how I memorize complicated nursing subjects. The first thing in the first lesson, first tip, is I memorize it on a whiteboard. So how do I do that? It's more of an active recall. So after every lecture or every subject, or at the beginning of the revision, at the middle and at the end, I always do one task that helps me a lot, which is I get a whiteboard and I write down everything I know about a certain topic or certain subjects or whatever matter we're studying. I usually focus on the things that already I know it's more likely that they will be in the exam, so I higher my chances of getting a good grade. But also I really write down everything I know, everything I learned, everything that could be actually important. So it's more of a it looks like a brainstorming process, but it's not. It's really more of an active recall on a whiteboard. So at the end, maybe I give myself like a 5 minutes, 10 minutes, so I really don't have to write down the entire lecture script, but it's more I write down the keywords, I write down the most important information that I really want or I have to memorize. Now, this might be important and this is interesting for two reasons. The first one is I know exactly the information that I already know. So when I am memorizing or learning, I don't have to go through those information again because I already know them. So focus on new information. Now, the second upward side of it is I get used, or I get myself used to actually recalling the information that I have, because a lot of the times in the exam what actually screws you up or screws us up, right, is not only that we don't know the knowledge, but maybe we're stressed or we're not used to just getting it on the spot, writing it down. So just getting and going through that process helps the brain to get used to that process of just thinking, getting the information in and being like, okay, I need to know 1, 2, 3, and I'm gonna write it down. Now I'm gonna walk down and actually go through the second point, or the other few points that I really want to talk about. The second point that I really wanna let's say process in here as well, which is teach the topic out loud. So now you would say teach the topic out loud is pretty vague, and a lot of people could actually, a lot of people could actually advise with it, but it's not what you think. So teaching the topic out loud can be with many tricks. My preference, honestly, is doing it right before the exam. So maybe I have an exam, it's in half an hour, I have my friends, I go to them and I just teach them what I know. And the trick is I ask them to do the same. Because it's not only when I teach, there is a better likelihood that I'll remember what I taught them, but it's more than that, when they teach me, it's more likely that I will remember what they taught me. So it's a double-edged sword, but in my advantage, not against it. So this works extremely important and extremely well, as I said, with friends. But it could also work alone. You can use AI for that. I use AI personally for that a lot. Or you can just use yourself. This is one trick that I always used to do even before nursing university, which is what I do is I just imagine myself giving the lecture about the topic, and I go on circles in a room. I just go on circles. I walk, because walking for some reason makes me think, and I just walk and talk through it, and this really helped me memorize it. I'll say the only thing that I would change if I go back is I wouldn't walk, as walking actually distracts you, or distracts even if a little bit of attention from the topic, which, well, let's say will not give you the best performance when it comes to learning. Now, if you want to learn and if you want to really get to the nitty-gritty and the details of remembering everything and getting the highest ROI for your time, return on investments of your time, what you really want to do is don't walk, don't do nothing, and that's what I usually do. I make sure that I don't even do the micro movements. I don't even move a little bit. Not a little bit. Why? Because I realized, actually it's nursing university, I realized that in that, one of the professors have taught me that, anatomy professor, she taught me that whenever you are doing something, if any small task, our neurological system will also think about it. So it will give to the task less percentage of our, let's say, consciousness, or literally just our ability and performance. You really don't want to get down your performance down. You really want to go all in, trying all in, going all in, trying to get the most out of your time, especially, and I know mostly for nursing universities, is that you're always against the time clock. The third point that I really want to talk about is mnemonics. Now, what is mnemonics? Maybe it's the first time you've heard of it. That, congratulations. It will be one of the best things you've heard. Mnemonics is one of the best ways to learn, especially if you are visual learners. In fact, most people are. There's about 5 types of learners. There is auditive or audition learners, the people that will like to hear, and there are more of the people that like to listen to podcasts a lot, etc. There's more of the people that will like to read, so they just like words. I had one of my best friends in nursing university, he's now working actually, and he was that type. He really doesn't remember the pictures, he doesn't remember the sounds or the teacher explaining, the professor explaining and all of that. He only remembered the words written, which is more of a photographic memory, but it's only for words. There's the other type, and I would say I'm more of that, which is the photographic memory. If I see something, I always remember it. Even when I remember when I remember the lecture, I don't only remember that section, but I remember that section, I remember how the teacher looked at that moment, the professor, the vibe, how was the colors, the lighting. So I have more of a photographic memory. And there is one last memory type, which is the touch and memory. And this is usually, they say, it's the hardest, and this is the final boss. If you do touch something, it's less likely that you forget about it more than any other types. And that's why in anatomy lectures, usually you will find professors having some skeletal systems in there. You touch them, you touch the femurs and the humerus, etc. Because that will not only give you a good idea of how it looks, but only how it feels, which really will just higher the chances like crazy when it comes to memorization. Now, the fourth point that I really want to talk about is linking concepts. Now, this might sound similar, but it's not. It could be similar in some ways. So, in mnemonics, it's more of given something. So, as an example, I'm talking about microbiology. In my notes, it might be a very good idea actually to add, let's say, a virus emoji on there, right? To draw a virus, to draw bacteria, to draw how it looks. Anatomy, maybe I draw the heart anatomy, etc. So when it comes to linking concepts, you want to link those concepts. So I want to link, let's say, something I learned in anatomy with pharmacology, because that will give me a better understanding of that. So what I do, as an example, let's say associate, I'll just give something random, yeah? So I'm gonna associate how, I really don't want to mess this up, but let's just say I want to associate some local motor system with, let's say, some anesthesia drug. So pharmacology with anatomy, it's 2 aspects, but actually when you link those topics, both of them, it will give you just a way better understanding, a better memorization, and it's just easier to recall after, because you don't have to remember both of them. A lot of the times you just have to remember one. So if I remember the anatomy lesson, then therefore it's more likely that I will also remember the pharmacology lesson, which is something that you should actually look out for. Now, the 5th point that I really want to talk about is the chunking. So the 5th lesson in here is chunking information. Now, how does this actually work? Now, usually in subjects and topics, you have a lot of information, a lot of diverse information as well. And you could actually learn it in different ways, different strategies as well, different, let's say, different ways and just different manners, right? Yeah, and that's exactly the video that I'm talking about. But when it comes to chunking information, it's more of you get a lot of information that has a lot of points in common. So let's say I'm studying, so I'm gonna give you a good example. Let's say for painkillers, let's say antibiotics, it's way better. So in antibiotics, we have families of antibiotics. We have penicillin, we have all of those, right? So what I really want to do is sort of make a brain map, and that's chunking information. So antibiotics, I want to chunk all of their families. Now in the families, I want to chunk all of the types and names and all of them. And that's really how chunking information work. So you're not only scattering and just choosing randomly which one you want to remember and which one you don't want to remember, but actually you do it chunkily, and you do it strategically. Now let's do a quick recap of all the 5 points that we've talked about. The first one is mnemonics. Make sure to use your visuals as well. Make sure to activate your visual memory with some pictures, maybe to your notes. Number 2, add chunking. You want to chunk a lot of information, a lot of info, that especially if it has points in common. Number 3, linking concepts. Maybe it's different lessons, maybe it's even different subjects. Anatomy and pharmacology are 2 different subjects. But as long as you can link them, it's way better, because you don't have to remember them both, but you only have to remember one. The 4th point is whiteboard recall. So whiteboard recall, you want to take a whiteboard, just put down there any information that you remember, and that will help you not only know what you know and what you don't know, but also will help you get used to getting the information out there. And the final point is teaching the topic out loud with your friends, alone, or to AI. Now if you have, please write down below your biggest problem when it comes to nursing university, and I'll make sure that I'll fix it, or I will show you how I fixed it in a new video. Thank you.